thank you, Dr. O'Shea, for this very kind invitation. I'm really humbled to be here. So my name is Karolina Gorzel, and I will tell you a little bit about my probably maybe less usual story and definitely a long story to medicine. So I was born and raised in Lublin. It's only one letter difference and over 2,000 kilometers. It's a lovely city on southeast of Poland. I really invite you to visit. We have lovely castle, old town, and obviously great food. It's only just twice as big as Cork. So when I was growing up, I never knew exactly what I wanted to do, but biology and different aspects of it were very close to my heart, particularly genetics and cancer due to my own personal family history. And because of all those interests, I decided to do a 5-year course with integrated master's degree in biotechnology. And I really enjoyed the 2 years of the research I did, and I felt maybe that's something what I should do in the future. So at that time, there wasn't too much opportunities to do research in Poland, and I was looking at different options abroad, and obviously Ireland was one of the top choices. So this is where I started. In 2008, I came to Ireland and started a position as a research assistant in UCD. And I was at that time researching in the lab, looking at different cholesterol pathways. And I learned a lot of important lab-based techniques and improved my research skills in writing, presenting, and designing research, which was really important to me going forward. At that time, I knew that what I really wanted to focus on is cancer research, and particularly female cancers, and that's why I decided to do a PhD in ovarian cancer, and specifically looking at chemoresistance in ovarian and breast cancer. I tremendously enjoyed these 4 years. It was great 4 years in my life, and I really loved that research. So during the last year of my PhD, I also started a collaboration with Dr. Madeleine Murphy, who is a mitochondrial expert, and we were developing some ideas around resistance driven by mitochondria and triple-negative breast cancer. And that research was then awarded by the HRB with the grant for which I was employed as a postdoctoral fellow. During all those research years, I was more and more becoming interested in clinical side of oncology, and that was really by meeting clinicians and really fascinating doctors during various meetings and conferences, but also meeting patients, particularly in patient voice and different meetings with patient charities. And really, I think a breaking point for me was attending translational medicine meetings and journal clubs in Vincents Hospital during my PhD years. And as cliche as it sounds, when I was walking into Vincents Hospital, I felt like this is where I belong. So this is what I decided to do next. I learned about graduate entry program, and I started studying for the entry test, and was offered graduate entry medicine in Cork in 2015. So it was just about 2 years into my postdoctoral fellow, so I stopped that and moved to Cork to do my graduate entry medicine. During those years, I was still involved in research. I was coming back to the lab in UCD and developing some of other ideas. And that work was then awarded by the academic track internship, which I did in the Mother Hospital. And since then, really, the road was straightforward. I knew as oncology what I wanted to do, so I applied for the internal medicine BSc, which I've completed now, and then applied for registrar position in oncology in St. Vincent Hospital. And this is what I started last July. I'm very happy. It's challenging work and difficult at times, but I'm very proud I did it. So in summary, really, my road to medicine was probably quite long. It was 18 years to date since I've started my undergraduate degree. It was very challenging in times and very difficult, but at the same time very rewarding. And I'm so grateful for all those opportunities. It was 2,000 kilometers away from home. So again, that was challenging, but I'm very grateful I did it. So going forward, I really hope I will be able to combine the both lives, the medical life and the research life, for my own personal satisfaction, but also for hopefully to benefit my future cancer patients. And thank you very much for listening.